Welcome back. Boundaries are the structures that keep the fiduciary relationship safe. So let's define three terms carefully. The boundary is the professional limit that keeps the relationship focused on the patient's care. A boundary crossing is a minor, often harmless deviation, a reassuring hug, a small personal disclosure, a gift. Many crossings are benign, even kind. A boundary violation is different, an exploitative breach that harms the patient and serves the practitioner. Here's the crucial teaching: violations rarely begin as violations. They begin as small crossings that are rationalized. She's a friend now, repeated, and escalated. That's the slippery slope. Vigilance about the small is how the serious is prevented. Now, the most serious violation, and I'll say this directly: sexual contact with a patient is never acceptable. The power asymmetry of the fiduciary relationship makes genuine consent impossible. And the dental operatory has real structural vulnerabilities that have, in documented cases, been exploited. The supine reclined position, sedation that impairs awareness and memory, physical proximity to the face, the privacy of the room. The safeguards are practical: chaperones, visible operatories, careful documentation. And the most important psychological safeguard: if you notice attraction to a patient, that is a signal to add structure and distance, never a license to act. Then there's the reality of dual relationships. Outside big cities, your patients are also your neighbors, your friends, sometimes your family. The overlap is unavoidable, so the goal is not to eliminate dual roles, but to keep the clinical role primary. Name the overlap openly. Keep records and standards identical for everyone. Treating those closest to you is its own hazard. It erodes objectivity, complicates consent. Try discussing risks honestly with your spouse, and tempts shortcuts in history taking and documentation. Routine care may be fine. Anything complex, sensitive, or ongoing is better referred. Here's the line to remember: love sometimes means sending someone to a colleague. Next video: difficult patients and the newest frontier of all, the relationship online.